So hi everybody, my name is Sarah and we are going to play a game. What do you guys think this game is called?
How would we call it?
Red light, no. Green
It's
light.
called the shopping game. How many of you like to go food shopping? You do? How many of you guys like to pick out things and put them in the cart? Me too. So today, you get to pick out things and put them in the cart, and there are 3 rules. Rule number 1. So this game is a nice way of illustrating all the different choices that we have to make in our everyday lives, which actually have big implications for the way that we eat and our diets and our long-term health. And so in this case, we took a whole bunch of choices and we said to the kids, we're going to put some rules on those choices. You can have 5 things, but you get 1 treat and you can't repeat any of your choices. And surprisingly, there was actually a fair amount of variation among kids who were roughly the same age. All right, well, I think we should go shopping. What do you guys think?
Yeah.
Grab your baskets. So how does this little game relate to the broader research that we do here at Harvard and at the Radcliffe Institute? So number 1, we are constantly faced with food choices in the environments in which we live. And it's more often the case that the food choices are unhealthy and not healthy. Particularly if you're in a state or a city where you have a large low-income or minority population, those populations tend to be at higher risk for poor diet, at higher risk for obesity, and lots of conditions associated with excess body weight. And so there's a real interest in thinking about what are the things that we can do to change the broader environment to encourage people to be healthier? Can you tell me of these items, which is the treat?
The soda.
The soda. So one of these things is a treat, Cecilia. Which one is the treat? What is that again?
Juice.
In life, one of the ways that research becomes important is when we do put rules in society, like for example saying that we're going to make beverages cost more money if they have added sugar, or saying that we're going to put calories on restaurant menus. When we add those sorts of rules, does that either change the way consumers behave or does that change the way industries behave? Why is juice a treat?
Because it has sugar.
Why is soda the treat?
Because soda has lots of sugar.
So let me ask you a question. If you were at school and they served juice all the time, would you drink juice all the time?
Yeah.
You would? You would drink it all the time? Is that a good thing or a bad thing?
Bad.
It's a bad thing. So when we think about different examples of is there evidence to actually support changes in our broader food environment that are actually having an impact on our health, the answer is yes. And so if we start with beverage taxes, Berkeley was the first US city to do this. And what they've shown is that about a year after the tax has been in place, that people's purchasing of those items has dropped by about 10%. Sugary beverages are one of the leading sources of added sugar in our diet, and they are huge contributors to weight gain. They also cause dental caries or cavities. Another example is on the restaurant setting. And so because there's this federal rule now which says if you're a large chain restaurant, so if you have more than 20 outlets around the country, you have to post calories alongside price. What the research shows is the impact of that is not that you and I make different choices at the point of purchase. There's a little bit of that, but not much. The impact is that restaurants are changing the amount of calories on their menu. So for example, if you look across these large chain restaurants, the average calories in newly introduced menu items has gone down by about 70 calories or 12%, which may sound small, but that difference can actually really have a big impact, particularly because on any given day, a third of kids and a third of adolescents and a third of adults are eating in these restaurants. And so if you're carving out calories and not relying on people to make choices, you are going to have more of an effect. Thank you for playing.
You're welcome.
Thanks for playing the shopping game.
Thanks, Mom.
Bye. 20 M&Ms, that's it.
Okay.